We're following up the Coroner's Inquest recommendations made after the incident's been reported over the last few weeks. About the incident, Dr. Burns, that happened 2 years ago, this gentleman who took his own life, and clearly you weren't up to it. The system let him down.
I don't think it's fair to say that the system let him down. I mean, this is obviously a tragedy, and it's always very, very difficult when somebody takes their own life, both for the family and for those who are involved in caring for them. Obviously, we have looked closely at what's happened, and the coroner, Mr. Needham, has made a very, very detailed inquest and made a number of recommendations which we are addressing.
Because the system let him down?
I don't think you can say that the system let him down. I think there were things we could have done better. There are always things we could do better. We have been, and we always are, trying to improve the system. And I think we have already addressed some of the possible failures in the system over the last 2 years, and we're continuing to do so.
That's right, failures in the system. This is, you're saying these words, therefore the system wasn't good enough, was it?
I think what we could say is that ideally we could have done certain things. Some things were not done. I think it always comes down to clinical judgment in any particular case, and there were some things that perhaps could have been done, and as Mr. Needham has pointed out, they might have changed the course of events, but there is absolutely no guarantee that they would have prevented this death.
But you can't be happy with some of the things that are mentioned in this report. I mean, you know, that you've been told you've got to change your systems and improve the way you're delivering these to the patients and public.
I think if you read the inquest report, I think you will see that the actual changes in the system are actually very minimal. Overall, the system has worked reasonably well, and I think you also need to look at the number of people who are treated by mental health services, the number of people who self-harm each year, and the overall number of people who actually harm themselves seriously or kill themselves.
But he wasn't taken seriously in that sense, and if procedures were changed, could he be here today?
I don't agree with you. This was taken very, very seriously.
Could he have been here today, though, if you had these implementations in place?
It is perhaps possible, but I'm afraid, as Mr. Needham has pointed out, there was absolutely no guarantee that any of his recommendations would have definitely made a difference.
So should people have confidence in you and your staff and what they're going to be, how they're going to be treated?
I think they should have confidence. I think this is an excellent service. We aspire to excellence all the time, and we are continually taking measures to improve the quality of our service.